lot of healthcare professionals have got an opinion of what you've been doing, how you've lived your life, and that reflects in how they treat you. You know what I mean? You're embarrassed and you're ashamed of going in there with these problems anyway, because you've, the self-inflicted majority of them. You know what I mean? So with that on top of how you feel already, it's it's not good.
No, it's hard, man. Yes. Yeah.
Trying to get to the doctors at 8 o'clock when you're homeless, it's impossible, because you've got to pack all your stuff away, and if it's been raining the night before, you're going to be soaking wet. You've got to go to the Friary to get your breakfast and have a shower before. So if you go to the doctors, you're going to lose out your food for the day.
When you mention mental health to somebody, it's an invisible situation. You can't see what's wrong. And it's very difficult to try and present that over the telephone or in person for that matter.
If you are seeing a different doctor each time, not only are you telling a story over and over again, you put yourself in a situation where you're kind of re-feeling stuff, and it's quite traumatic, or it can be.
So then if you can't walk very good, you've got to that's the taxi. If you've got money for the taxi, you've got to get a bus.
People who experience SMD, significant multiple disadvantage, can face a lot of challenges accessing healthcare because of their circumstances. They might not have a telephone, they might not be able to call at a specific time, they might have difficulty using online platforms because of data poverty and not having access to Wi-Fi or data plans on their mobile phones. So it starts right at the front door and then carries all the way through. And I think if there's not a high level of understanding from the reception staff and staff working in general practice, then people can make all sorts of assumptions as to why people are behaving in these ways and not understand the challenges that people face.
It's a scary place going to the doctors anyway. I'm going in there on a worried basis anyway, and then getting worried about what's going to happen with the GP appointment. If you think we're switching off, we're not. At the end of the day, I've got more anxiety in us than a normal kind of patient.
Something needs to be put in place on their medical notes to say that they need extra support, so that the receptionist, anybody who works at a GP practice, anyone who works at the hospital understands that this patient, is experiencing SMD and they need further support to face, the barriers of them accessing healthcare.
Trying to put in place the things that will help the most disadvantaged of patients actually helps everybody, and most importantly, it actually helps the staff as well, because if you've got patients that feel valued and not judged, they behave in a completely different way from people who feel threatened, judged and out of sorts.
I think communication, if we can get that right, I think we're on the road to success, because without communication, how can we meet the needs of individuals?
If we get the basics wrong, then people actually need so much more help further down the line in terms of unplanned admissions to hospital, unplanned operations through not managing their healthcare conditions better. So there's just so many opportunities from so many different directions. So I'd really encourage people to take this issue seriously.
When I started working at Platform One, it was just the last sort of 5 years of my career. I wasn't going to do very much more, and here I am nearly 15 years later. Yeah, I just feel it's unfinished business for me. And it's also about supporting the next generation of doctors to further these projects and to really support people with severe multiple disadvantage.
I want to make a difference, and so seeing all these changes and seeing that I can be part of it, it makes me proud, and I think it's an amazing project to be part of.